Hey, Curtis.
Mary had a little lamb.
Well, good evening, everyone. First, I would like to say thank you for taking the time to be here on tonight. Being a mother of five, I have three boys and three girls. I remember days of assisting one with homework, chasing a potty training toddler, and at the same time getting dinner ready with one still in the belly. And to all of the expectant parents on the line today, we applaud you and say thank you for all that you do. Tonight, we have some amazing presenters who are going to share about their organizations and some of the resources that are available to you. Before we get started, I would like to cover some housekeeping items. Number one, everyone is automatically muted except for the presenters. Only the presenters for today have video capability as well. This allows you to be able to be present with your children and be present here all at the same time. We also want you to be comfortable. Hey, we know you're pregnant and we understand what that feels like. So sit with your feet up and enjoy this time of learning. There are two ways that you can submit any questions that you have during the presentation. You can use the Q&A button or you can also use the chat function. Whichever you feel most comfortable using, the difference is the Q&A is going to show up anonymously to us and the chat function is going to display your name. However you feel most comfortable asking your questions, we are glad to answer them for you. And at the end of this, there will be a lucky winner who is going to win a pack and play on tonight. So it will be announced at the end, so you'll want to stick around for the entire presentation. All you need to do is be present to win. So I'm very excited to present to you Amerigroup Iowa, who is our sponsor on tonight, Unity Point, as well as Siouxland District Health and the Hopes Program. I am Stephanie, and I am with Count the Kicks Health. So my job here at Healthy Birthday, I'm the Health Equity Coordinator with Count the Kicks. I began my work with Count the Kicks after finding out about the inequities in birth outcomes when it comes to stillbirth rates within the African American community. We were working together with a group that's called the PMA here in Des Moines, and we were targeting those who, the mothers, we were targeting the places where mothers often receive their support outside of their obstetrician. And for some, it's their hairdressers. For others, it could be a local church or a community organization. While we were working on the Count the Kicks campaign, my son and daughter-in-law became pregnant. I asked Courtney if she had heard about the Count the Kicks app. And on her due date, Courtney thought that she was in labor, but noticed that Luna wasn't moving as much. Originally, they told her to drink water, lay on her left side, and to time any contractions that she was feeling. She was a first time mom, and there are times that we can feel a little anxious about giving birth. But Court decided to go ahead and go into the emergency room because she noticed that Luna just wasn't moving like normal. She was able to provide the doctors and the nurses at the labor and delivery triage with the data to show them that Luna wasn't moving like normal. They found that there were actually two health issues that would have prevented our Luna from having a healthy birthday. Since then, I've continued sharing my story, empowering women by teaching them the importance of counting as well as tracking their fetal movements. This is my dream job, and I am so honored to be with you here on this evening. So tonight during our time together, we're going to have some icebreakers just to have a little bit of fun. A poll is going to pop up on your screen here shortly. And so we're just going to ask you some questions about, what trimester you're in and do you know what you're having? All of those fun things that we're so excited about when we're getting ready to have a baby. Then I'm going to present on Count the Kicks. Amerigroup Iowa is going to come right behind us to tell us about some awesome things that if you are connected with Amerigroup, some things that you'll be able to take part in. Then Unity Point is going to come in and talk about what it looks like for labor and delivery with them. Siouxland District Health is going to share about baby basics, the safety of the baby when you have them in the car seat safety, things of that nature, and even WIC. And then the Crittenton Center is going to talk about the HOPES program, as well as some other programs that they have available that may be of use to you. And then we're going to do some question and answers. So again, feel free to load up that chat with your questions, or you can also use the Q&A function. Lastly, we'll go ahead and choose that pack and play winner. All right, for our first icebreaker, we want to find out what you're having. So I'll go ahead and put this on here. And you should be able to answer it now. So 10 little fingers, 10 little toes, 2 little eyes, 1 little nose. Boy or girl, nobody knows. All right, Team Pink and Team Blue are neck and neck. All right. So it looks like we are half and half at this point. We've got 1 girl and 1 boy from the answers that were actually shown here. So I'll let you see the results. All right. So we'll go ahead and go to our next icebreaker. What trimester are you in, and have you heard about Count the Kicks? I'll go ahead and launch those 2 questions so that you can answer them. We'll give you a second to answer the questions there. All right, so it looks like we're in the 2nd trimester. And yes, we've heard about Count the Kicks. That's awesome. Thank you so much. So before I begin my part of the presentation, I always like to start with a feel-good story about a baby save that was shared on Good Morning America. On our website, you'll see many others like this story, but this one is about baby Ruby, who was saved when her mother used our free Count the Kicks app and was able to share her kick counting data with her doctor, letting them know when baby Ruby was in trouble. Let's take a look at this video and see how counting her baby's movements saved baby Ruby's life.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
All right. As you can see, our Count the Kicks app is a tool that not only empowers you as expectant parents to speak up when you notice decreased fetal movement, but it also helps to save lives. So with Healthy Birthday and Count the Kicks, I wanted to share a little bit about who we are and how we were founded. Healthy Birthday was actually founded in the early 2000s when 5 moms endured the heartache of losing their daughters to stillbirth or infant death. They got connected through their friends and pastors, and they had a whole lot of conversations over coffee. The women decided to turn their grief into stillbirth prevention efforts to keep other families from facing the pain of losing a baby. In 2004, they worked with the Iowa legislature to create Iowa's stillbirth registry so that they could begin collecting data around stillbirth. A few years later, they attended a public health conference in Norway where they talked about seeing a 30% reduction in stillbirth simply by teaching pregnant women how to monitor their fetal movements during the 3rd trimester of pregnancy by doing kick counting sessions on a daily basis. So we didn't create kick counting, but we created the tools to help parents do it. After this conference, they came back inspired by the research and they birthed Count the Kicks. Count the Kicks is our evidence-based public health awareness stillbirth prevention campaign. Now, I'm sure that everyone on here would agree stillbirth is not a subject that anyone wants to talk about. You're not sharing it at different family functions and things of that nature. This is why you'll notice when you look at our materials, they are fun, bright, colorful, empowering. This is exactly what the founders wanted. It's mom focused, educating expectant parents on the importance of tracking fetal movement. You are able to complete your kick counting session on our free mobile app, or we also have paper charts for those who don't have access to a mobile device or don't have good access to internet. So in 2009, what they did is they created Healthy Birthday Inc., which is the nonprofit organization based out of Des Moines, Iowa, that is the headquarters for Count the Kicks. So someone might be asking, is learning about stillbirth important? Is stillbirth really a concern here in the United States? Unfortunately, the answer is yes. Across the U.S., approximately 24,000 babies are lost to stillbirth every year. Statistically, that means 1 out of every 169 pregnancies end in stillbirth. For African American moms, that number is even more alarming. It's 1 in 96. Families are 10 times more likely to lose a baby to stillbirth than they are to SIDS. When we ask expectant parents if they have heard about the Back to Sleep campaign, most are able to answer yes. However, when the question is posed regarding counting fetal movements, there are still many who are unaware. Our goal here at Count the Kicks is to save 7,500 babies from preventable stillbirth by educating you, the expectant parents, on how to count your baby's fetal movements. At Count the Kicks, we have a laser focus on stillbirth prevention, and we are committed to reducing preventable stillbirths and eliminating disparities. In Iowa, where the campaign started, the stillbirth rate has dropped nearly 32% in 10 years. And for African American women, it has dropped 39%. Counting your baby's kicks and jabs, pokes, and rolls is important because a change in movement in the 3rd trimester is often the earliest sign of distress in a baby. When moms know what's normal for their baby, then they are more alert to potential red flags. You're already a great parent. This is just a simple, free, and easy thing for you to do. So using the app to count your baby's kicks is very simple. It is as easy as counting to 10. Once you reach your 3rd trimester, around 28 weeks for a normal pregnancy and 26 if you're considered high risk, we want you to start monitoring those kicks, jabs, rolls daily, preferably at the same time, keeping track of those kicks and see how long it normally takes for your baby to get to 10 movements. After a few days, what will happen is you'll begin to see a pattern. The app is going to show you what the normal amount of time is for your baby to get to 10 movements. Keep in mind, every baby and every pregnancy is different. So the key is knowing what is normal for this pregnancy, for this baby. We also have the ability to track the movement for twins. If your baby's normal changes during the third trimester, this could be a potential sign of potential problems. And it's an indication that you as the mom, you as the expectant parent, should call your healthcare provider. What would be considered a change? You would want to look at your baby's history in the app to see what their normal pattern or trend is. And if you see that it's taking significantly longer than what it normally does, you'll want to go ahead, share that data with your provider as well as your family members. You can also count for singles or twins. Most providers believe that moms can actually tell which baby is moving. And so you'll do the same thing. You'll see that same pattern, that same trend. And if you notice that there's a difference and you have twins, you'll want to call your provider. When you log in, you'll see exactly what you need to do. It's very simple, very easy to do. Our app is free. It's available in 12 languages. It is also available for both Apple and Android. And so I can remember when my 3 boys, when I had all 3 of them, I was busy, busy, busy all the time. And maybe you're like I was at that time, because my boys at this point, they are 30, 31, and 32. So I can remember being in the middle of doing things and trying to chase one who was potty training. And so if you're anything like my mothering experience was, you can be in the middle of a kick counting session and you've got a toddler who is trying to potty train. So if you get interrupted in the middle of your kick counting session, you simply restart the session. Or if you accidentally track more than one movement, you can hit the button and you can delete a kick. Again, we're mom focused. So we know what it feels like to be busy all the time. And for me, pregnancy brain was a real thing. So we've created a daily reminder system that tells you when it's time for you to start counting again. To get started, we want you to sit with your feet up or lie on your side. You're going to register on the app. It's going to ask you if you would like to count for single babies or for twins. And when you choose twins, the kick counting session will include 2 buttons. One button is going to count the movements of baby A, and one button is going to count the movements for baby B. All you're going to have to do is just slide back and forth. So you'll notice in the upper right-hand corner, the way that you're going to track it is you're going to just tap that little footprint every time you feel a movement. You can count a kick, a roll, or a jab, anything except for hiccups, because hiccups are involuntary. So it'll, after a while, begin to show you the pattern you'll see up in the upper right-hand corner. This baby takes approximately 15 minutes to get to 10 movements. So if something happens and you notice that it's different, that's when you would definitely want to say something to your provider. So I would say, maybe a spike in the amount of time could maybe be like an hour if it's usually 15 minutes and now it's taking an hour. Contact your provider, let them determine what is the best way to approach this, what tests would need to be done. The other thing that I want to share with you is that you can also use our Count the Kicks app on multiple devices at one time. Your account will follow you regardless of what device you're using. So you can be on an iPhone, you can be on an iPad, and also on your Apple Watch. It's now available on Apple smartwatches, and you can also include notes for each session. Another new feature that we have is the ability to track the strength of the movements during each session. Research shows expectant parents should also be paying attention to the strength of their baby's movements. At the end of each kick counting session, expectant parents will be asked to rate the strength of their baby's movements. You can rate your session from fluttery, which is going to be the light movements that are hard to see, to fierce. And those are the strong movements where you can visibly see the baby moving around inside. You can also add a note. This one just simply says, baby felt strong like normal. Or you can say, baby wasn't moving as strongly as I've seen before. You can put those notes in there so that you can keep track of what's going on. Again, knowing what is normal for your baby is what you want to pay attention to. To see how easy it is to use our app, we want you to watch this quick video and you'll get to see how this app is actually used.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So as you can see, the app is very simple to use. It is the non-invasive way to know exactly what's going on with your baby while the baby's in utero. So sometimes we like to talk with expectant parents who may not feel that kick counting is necessary. And when we ask them why, we found that there are some common misconceptions as well as some outdated information and even outdated practices. One of the misconceptions that we hear a lot of the times is that babies move less the closer that they get to their due date. Babies don't move less, they just move differently. You may feel less sharp kicking and more rolling instead. However, if you're monitoring your baby's movements at the same time each day, it should take about the same time to feel the 10 movements. If not, speak up. Remember, you are your greatest advocate and you know what and how your baby normally moves. Don't be afraid to let your doctor know if you feel like something is off. Another misconception is, my baby is always active. I don't need to count their kicks. Active babies can also experience distress, sometimes quickly and without any other warning signs. Tracking your baby's movements every day takes the guesswork out of knowing if your normally active baby has slowed down for any reason. Think of it from this perspective. When we don't feel well, we don't move as much. We're not running marathons. We're not out grabbing groceries. We usually lay around and don't move as much. It's the same for baby in utero. So again, if you notice a change, don't be afraid to speak up. Another misconception is, I can hear the baby's heartbeat on a Doppler device, so I don't need to worry about it. A change in the baby's heartbeat is one of the last things to occur when a baby is in distress, where decreased fetal movement is an early sign. The next one is babies running out of room. Well, babies should continue to move up to and even during birth. And the last misconception I'd like to address is that mom should get 10 kicks in 2 hours. Remember, every baby is different and you'll want to know what is normal for your baby. If there is a change and you don't feel like your provider is hearing you, follow your instincts and go to the hospital and share your baby's kick counting statistics. That's exactly what my daughter-in-law did, and our Luna is here today. Let them see the difference that you've noticed in the average time that it's taken for your baby to get to 10 movements. This concludes my portion of the presentation. I love ending it with this amazing video that is with our partner Amerigroup Iowa. Now this video I usually get a bit emotional on, but it's just an amazing thing about why we are partnering and why our partnership is so important. Let's take a listen.
My name is Jeffrey Jones, and I am the plan president for Amerigroup of Iowa. When we first launched in Iowa in 2016, we were very focused on identifying those community partners that had a shared mission. And one of the key components of that mission is improving lives in communities. We work with our expectant members to do things like arrange car seats, food and supplies like diapers for our members, transportation to get to their doctor's visits, and even in some instances, housing as well.
We have a dedicated team of case managers. They are nurses that serve expectant mothers throughout the course of their pregnancy. The intent is really to make sure that those members get all of the services, the resources, the education that they need in order to have a healthy delivery. We support organizations that do that as well.
We're here today to celebrate an organization called Healthy Birthday, and specifically one of their offerings for membership called Count the Kicks, which was a very simple, easy to use and free for expectant mothers, and it helps them monitor their third trimester of their pregnancy. It is a life-saving tool.
It is a thrill to be among you today because you are the game changers when it comes to improving the health of moms and babies in Iowa and in our community. Count the Kicks was founded out of grief and out of loss by 5 women here in Iowa who all lost daughters to stillbirth or infant death. They didn't know each other before they lost their daughters, but they were brought together by mutual friends, pastors. So they got to know each other, grieved together for a very long time. And after a while, they looked at each other and said, what are we going to do with this grief? Because we don't want any other families going through what we've gone through.
Our whole world turned upside down. Emma was, her heart was not compatible with life. I knew that I didn't want to become that bitter, angry person that people whispered about. You know, she's that way because she lost a baby. And I knew I had to make good from a devastating situation.
Eventually they found research that showed the importance of tracking fetal movement in the 3rd trimester and for expectant parents to speak up if they notice a change in what's normal for their baby, and that babies can be saved if expectant parents speak up when they notice a change.
We looked at each other and we said we have to do something in our girls' honor, and that's how we are going to be moms to the girls that we lost.
I know Amerigroup cares about the health of women and babies, and so I was very hopeful that they would want to invest in our campaign and believe in our campaign. And so we were thrilled when they said yes, and on such a fantastic scale. We truly believe that Amerigroup helped contribute to the lowest stillbirth rate on record for the state of Iowa.
The opportunity to have a member come in who was able to take advantage of this program and quite frankly saved her daughter's life. Being able to have them come in and have our associates connect back to, here's the impact you have on our members each and every day. It's a tremendous opportunity in living that mission and journey.
It's a good app, like, you know, it's very detailed, it's bright, it's informative, and it's simple to use.
Knowing what's normal for your baby and the importance of that can make all the difference. I tell my friends, and then my friends tell their family members.
It's incredible what it's blossomed into here.
To see these faces, these beautiful faces, and to see the moms who are just beside themselves grateful that their baby is here because of something you've done. I cannot think of any better way to spend your time on earth than to do something like that.
I want to encourage everyone to take the time just to download that app. It's free, and it also helps with bonding with the baby. You can get mom and dad and siblings all involved in counting those kicks and everyone can be a part of the growth and development of the baby before baby even makes it here. Next up, I want to introduce Lauren, who is going to share about Amerigroup Iowa. Lauren, take it away.
Great. Thank you so much, Stephanie. Good evening, everyone. My name is Lauren. I'm a community relations representative with Amerigroup Iowa. You can go ahead to the next slide. So Amerigroup is one of the 2 Medicaid managed care organizations that provide Medicaid health benefits to the people in Iowa's Medicaid programs. We've been serving members in Iowa since 2016, the beginning of managed care in Iowa. We do cover the entire state, but DHS is who determines eligibility. Next slide, please. So to find out if you're eligible for Iowa's Medicaid program, you can apply online or at your local DHS office. At the time that you're approved, you will receive notification from the state, and that is when you will have the opportunity to determine which managed care organization you wish to go with. You will be tentatively assigned one of the 2, and you'll have up to 90 days to change. This often leads to the questions of why or how to choose one organization over the other. The very first thing I recommend is checking your providers' networks. So essentially, what companies or insurance do each of your providers accept? You can use the Find the Doctor tool on our website or contact your providers directly. The next piece of advice I would share is for a member to review each company's value-added benefits, or what I like to simply call as our perks. With the Amerigroup, we have many different perks and value-added benefits, and this is what I'm excited to share with you this evening. Next slide, please. So the Healthy Rewards program is my favorite perk to share about. Put simply, Healthy Rewards is a debit card incentive program. Our members have the opportunity to earn dollars for completing certain healthy activities or going to certain appointments. Our pregnant members, new moms, and babies have really great opportunities to earn funds. Next slide, please. So to start earning reward dollars, our members must enroll. Our members can do so by calling into member services, calling directly to the Healthy Rewards team, or visiting the Benefits Reward Hub. Those phone numbers and web pages are on your screen, but don't feel pressure to write everything down quickly. I will drop all of the key phone numbers and information into the chat at the end of the presentation. Next slide, please. The Benefits Reward Hub is what you're seeing on your screen here. So our member would log on to their secure portal and navigate to the Benefits Reward Hub, and this is what they would see after they enroll in the Healthy Rewards program. So once enrolled, members can earn funds for certain health visits or healthy activities. Some examples that may be applicable to those of you on the call this evening would be the prenatal and postpartum check, earn a combined $75. Taking that new babe into all their wellness exams for the first year of life, earn $50. Completing a health risk questionnaire every year earns $25 per year. And then going to that annual wellness checkup, $25 per year per member. So there are many more options and that go beyond moms and babies, but that's just a sampling. All eligible activities will be loaded into these fields, kind of these rectangles on your screen. And up at the upper right-hand corner, you can see the balance that's currently available. So within this sample account, they have not yet earned any funds, but you can see across all the different pods, all the opportunities that they have to earn dollars. What's great about this is almost all of the activities are triggered by the claim hitting our system. So you go to your wellness visit, that claim hits our system, the $25 loads onto the account. The prenatal and postpartum check do require a self-report. So mom would just want to be sure to call in and get that reported to the system. So those dollars load onto the account. Those reward dollars can then be redeemed for gift cards, which I'll show you on the next slide, please. Here are some examples of retailers that you can select to earn a gift card from. You can pick a physical gift card mailed to you or an e-gift card sent for immediate access. One of my favorites is the Amazon option, that convenience delivered right to your door. These retailers are always subject to change, especially as new retailers become available. We're currently in the process of adding the Bye Bye Baby store, so keep a lookout on your portal. Next slide, please. The other perk I wanted to share this evening is new for 2021. It's one that I'm very excited about. Amerigroup Iowa pregnant members or Amerigroup Iowa members that have delivered within the past 6 months are eligible to receive a dual electric breast pump. Members can access this perk by calling Medline directly at a number I'll provide at the end, or going onto the Medline portal, which you see on your screen. Next slide, please. To order online, members will create and activate their Medline account. Members will just simply need their member ID and date of birth to create that account. And once logged in, it's simply like ordering, like you're shopping online. Next slide, please. As you can see on your screen, this is the Medline Deluxe Electric Breast Pump Kit. It comes with the tote bag, breast shields, bottle supplies, cooler bag, ice packs, battery adapter, and most importantly, the pump itself. Next slide, please. When a member logs on to that Medline account, this is the landing page. You will simply add to cart and check out. Next slide, please. The member's address that is on file with Amerigroup will be automatically loaded into the site. If someone has recently moved or needs it shipped to a different address, they can update their account, but it does preload that for just ease of ordering. The breast pumps are mailed and received within 1 to 2 days, and it's that simple. Members can always call into the phone line for assistance ordering from a Medline representative. I do also want to note members have the right to request the pump at their convenience once they're noted as pregnant in our system. But please keep in mind the 1-year manufacturer warranty starts from the ship date. So some may suggest or prefer waiting closer to their due date to order that pump, but that's a completely personal choice. So I hope this benefit will impact all of you. And I hope we are really excited to be the first Medicaid managed care organization to offer this benefit. Next slide, please. So this is the Pregnancy and Beyond resource guide that is shared with all of our pregnant members. It's also available on our website and has a lot of great information. The Taking Care of Baby and Me program is Amerigroup's care coordination program for pregnant members. It's very important to see your primary care provider or OBGYN for care while you're pregnant. Amerigroup does have OB high-risk case management that helps pregnant members with complicated healthcare needs. Our high-risk OB case managers provide support to pregnant women who are considered high risk and are 35 weeks or less gestation. The goal of the program is to provide one-on-one support to ensure that pregnant women have access to the appropriate care and other resources needed for a healthy pregnancy. Our nurse case managers can help collaborate with your providers to make sure you're receiving appropriate care, medication, medical supplies, consultations needed. They also can provide with assistance with getting medical supplies, make referrals to local community resources, those of some of which you'll hear from tonight, things like WIC, access to transportation, housing, and other local pregnancy programs. They truly are a trusted resource and connection. Additionally, we have case management for those babies and families that are in the NICU. The NICU case management program is designed to help parents cope with that day-to-day stress, teach them about staying involved in the care of their baby, and help them prepare for going home and be prepared for discharge. Our case managers will assist with education, resources, referrals to prevent baby from being readmitted to the hospital. We do also have brief care coordination that can be offered to our low-risk pregnant women greater than 35 weeks, and postpartum moms if services are needed. If any of these case management programs are something that you are interested in, please contact member services or talk with your provider who can help complete that referral. Next slide, please. Here on your screen, you can see more information and resources that are within that resource guide, but ultimately our goal is to keep you and your baby healthy. Next slide, please. Our Amerigroup Iowa website has a resource page for our pregnant members. Housed here are internal resources and external partnerships and much more. This can be accessed by anyone, not just our Amerigroup Iowa members. It's also worth mentioning that our Medicaid members can receive mileage reimbursement or transportation to their medically necessary appointments. As I'm sure you're all finding out by now, or you will soon, there are a lot of appointments when you're expecting. We also have a 24-hour nurse line and much more. So please be sure to log on to your member portal to view all of these resources. Next slide, please. I do want to express my sincere gratitude for your time tonight. Congratulations in advance. If you do have any questions for me, or if I went over something too quickly, please feel free to use that chat box and I'll do my best to answer. Like I said, I'll be dropping all those phone numbers and websites into the chat. Once again, congratulations and thank you. And I will now be turning it over to Michelle. So thanks so much. Have a great evening.
Welcome. I'm Michelle Jansen. I'm the OB educator here at St. Luke's, or for the hospital. So going to go through a few things here about Unity Point Health and what to expect in your hospital stay. First slide, please. So a couple of things about our hospital. Unity Point has a pediatric hospitalist program. I don't know if most people are aware of that. That means this can be if you're from out of town and have a doctor that you want to see your baby that doesn't have privileges at our hospital. Our hospitalist providers can take care of you while you're here. If you have a baby that gets admitted to peds, they're available to help in that situation as well. We also have an on-site NICU here that is staffed with neonatologists and neonatal nurse practitioners that are available if a newborn is needing assistance. And we have a partnership with the Ronald McDonald House here in town, and we even have a couple of Ronald McDonald House kitchens within the hospital. Next slide. So what do you need to bring? That is a common question we get from a lot of mothers. Do they overpack? Do they underpack? What should they really bring? So I went through a list of a couple things that you can bring. You know, any personal toiletries, your own shampoos, your body washes, things like that that make you feel comfortable. You can bring some extra pads, underwear, slippers to kind of walk around on the floors, anything that's comfortable for pajamas. And in a nursing bra is very helpful if you plan to breastfeed. You can also bring your favorite pillow, blanket, anything that makes it kind of cozy for you while you're here in the hospital. We also have a refrigerator in the postpartum room. So after your delivery, feel free to bring your favorite snacks up that you can have available for you and your support person in the room. Unfortunately, in labor, we don't have refrigerators, but we don't really let you eat either in postpartum or in labor and delivery until after that baby's born. Things to put in a baby's bag. You need to bring a couple outfits for baby. You know, what do you usually want them to go home in? And if there's other outfits you'd like them to wear during their stay. Our babies are not required to wear any sort of outfit. We do provide a t-shirt that they can wear while they're here if you prefer to just them wear just a regular t-shirt. We have some diapers, but you'll want to get some diapers definitely available for when you get to go home. If you have a swaddle blanket, that would be beneficial as well for when you're at home. And if you have a special pacifier you'd like your baby to use, to bring that along as well. We do provide a pacifier here. If you would like them, you would just need to ask your nurse for them. You will also need to bring a car seat to take your baby home in. What's important with that is to make sure your car seat's not expired, and you can find that on the base of the car seat. There's usually a sticker attached to the car seat that has an expiration date. If you're getting a car seat from another individual, make sure it has not been in a car accident of any sort. If it has been, you'd want to get a different car seat. And some local fire departments may provide some car seat like testing to make sure it fits correctly or kind of fit correctly in your vehicle. You would just kind of check with your local organizations. And I think actually our Siouxland District Health might have some more information on that later on in the presentation. Next slide. A couple things with check-in. You can go online to pre-register, but it's not necessary to do that when you arrive. We will still get some registration information when you do arrive at the hospital. The main lobby of our St. Luke's hospital is staffed with an individual down there at the front entrance from 6 in the morning till 10 at night. If you happen to arrive after 10 o'clock, our front door of the hospital is locked, but there is a doorbell right outside the door. Just push that and the operator will let you in. If at any reason you're arriving emergently, we recommend you go through the ER entrance as they may be able to get you up to our floor a little bit quicker. A couple of things to bring with you is to bring some sort of ID and your insurance card. That way that will help the check-in process go a little smoother. And make sure you would like to know when you do check in and come to the hospital who you want your baby to have for the newborn physician here at the hospital. You can pick anybody that has privileges here at St. Luke's. So feel free to check around town, or if you have a certain provider in mind, make sure they do have privileges to St. Luke's so they can take care of your baby. If you still want to find a provider and they don't have privileges at St. Luke's, you can definitely use our pediatric hospitalist program and then do their follow-up care in the clinic with that provider. Next slide. So I did include a picture of what our birthing suites typically look like. We do have 8 birthing suites here in our hospital. If you're a patient, though, that will need a C-section, we do have 2 OB operating rooms right on our floor as well. We don't take you off the floor. You deliver right here on the same labor and delivery unit. 4 of our birthing suites do have whirlpool tubs. Those are available for patients to use if the doctor's okay with the patient using them. In some situations, the doctor doesn't allow the patient to use a whirlpool tub. In other situations, they do. We do have a central monitoring system, so we can monitor your baby 24/7. So once we put that baby on the belt to kind of hear the heart tones and your contractions, we can see that anywhere on our floor. If for some reason you would like to do a little more movement while you're in labor, we do have portable monitors, which same thing, they're belts that hook around your belly, but they're portable, and so they'll trace your baby's heart rate here on the floor as well. Some patients do have their own personal birth plan that you can find, and there's sample copies out online as well. With your birth plan, just make sure you review that with your provider before you come into the hospital so that your doctor as well knows what your plans are when you get here in labor. Next slide. Include a picture of some of our nurses who are working the other day, and we just kind of took their picture quick in the hallway. But we do have a great group of nurses back in labor and delivery. They're very skilled and knowledgeable. They will advocate for your birth plan, whatever that includes. During your delivery, you will have several people in your room. You'll have your nurse who took care of you for the labor. You'll have a nurse for the baby. We usually have an OB tech in the room, and then your provider, of course, will be at the delivery. If you are high-risk delivery, we also have NICU join us in the delivery as well. The support person can be in the room present with you at the time of delivery as well. And so we just need to know who that person will be before that time arrives. Next slide. So now that baby's been delivered, what happens next? So after the delivery, we encourage skin to skin. If your baby delivers, it's healthy at delivery, mom's healthy at delivery, we encourage that baby to go right on mom's chest, right at delivery. We encourage breastfeeding to happen in that first hour. That's when the baby is most awake. Typically after that first hour, the babies get a little sleepy, so then it's a little harder to get them to nurse. And like I said, that first hour, they're wide awake, their eyes are open, and they're usually most active. So we like to get them to nurse at that time. The patient remains in the labor and delivery room for about 2 hours after delivery, as long as the mom and baby are stable. After the 2 hours, we move you to postpartum, which is again on the same floor, it's just on the other end of the hallway. Next slide. Here's a picture of labor or of postpartum. On postpartum, we have our patients typically stay for a vaginal delivery about 1 to 2 days, and for a cesarean anywhere from 2 to 3 days. Again, this is all dependent on the provider for the mom and the baby when they get to go home. We offer a lactation consultant and a lactation counselor who are available for patients who are breastfeeding if you would have questions. On postpartum, we also encourage the moms and newborns to room in. We do have a nursery available kind of in the overnight hours and in the morning if the mom would prefer to get some sleep, but typically we like those moms and newborns to room in so they can get together and learn to bond with each other and read each other's signals. Providers will round on the mom and the newborn during your stay. Sometimes that is the provider that delivers you. Sometimes it's who's covering for their office that day, whoever's the on-call physician. And usually if you visit with your provider prior to coming, you'll know what their on-call routine is. A couple of things about the baby's bath. When we give a baby the bath there on that first day, we like to give it anywhere after about 4 hours or more after delivery. We just make sure the baby's temperature is good and the baby is stable before we give it. It's given right in a little baby bathtub. It does have a little temperature reader on it, so we know if it's too hot or too cold for the baby. And we just do what's called a swaddle bath. So we kind of wrap the baby up in a blanket or towel and sit them right in the bathtub to give that first bath. Babies stay a little more calm with this and don't get as cold. Many years ago, we used to do a sponge bath, and so you might have your own parents say that's what they used to do with babies, but now we put you right in a tub of water. Next slide. So when it's time to go home, a lot of people are unsure what that process looks like. So there's a couple tests that have to happen for moms and babies. A couple things with the little one before the baby gets to go home. They do need a hearing screen, a metabolic screen that we'll do here, and we do a heart screen, congenital heart screen on the baby when they're 24 hours of age. So once that baby hits that 24 hours of age mark, there's several tests that we quickly do on that baby. Providers will let you know when the mom and the baby can be discharged. Again, you'll need the doctor to authorize discharge for both yourself and for the baby. So maybe your doctor might dismiss you, but might wait on baby or vice versa. It will all just kind of depend on the baby and your situation. After the discharge orders are in from the mom's doctor and the baby's doctor, it takes about 1 to 2 hours to complete any of those final tests and for paperwork to get ready for you to be dismissed. We do need a birth certificate to be completed before you go home, and that's where you're going to officially name your baby. That gets sent into the state of Iowa. If a couple isn't married, we have them complete what's called a paternity affidavit. With this, both those people, the dad of the baby and the mom will need both their IDs for this paperwork, and then we can notarize it right here in the hospital. If for some reason you don't have any IDs available during your hospital stay, we can send the notary form with you, and you can go to somewhere local in town like a bank, library, courthouse, and they have a notary available that could do this as well. And then it would need to get sent to the state of Iowa. Next slide. We do offer in our hospital a baby weight clinic. This is available every Monday from 1 to 7. You would just have to check in at the hospital front desk to let them know that's what you're coming up to do. The baby weight clinic is staffed with a lactation consultant or a lactation counselor. So if you do have some breastfeeding questions or you get dismissed and you have some questions as well that came up with breastfeeding, you can definitely come into that baby weight clinic, and they're there to help you. We do offer a baby weight clinic, like I said, every Monday, unless it is on a holiday Monday, and then they offer it the very next day. The baby weight clinic phone number is listed, and that is 712-279-3329. That you're welcome to contact that number if you do have questions, or if you do want to get in touch with a lactation consultant or counselor after you've been discharged, you're welcome to call back to the units, and those can be included on your dismissal instructions on how to contact the hospital to get a hold of them, and they can get it back in touch with you. Next slide. So the Ronald McDonald House Kitchen, I mentioned this earlier. These are for our families who have children in the NICU, in pediatrics, or if maybe it's a mom in labor and delivery who is here a lot longer than she originally planned because maybe she's had some pregnancy complications. And we do have this kitchen available for those family members that come to visit. And so that is supported by the Ronald McDonald House and generous donations from the community and things here in the area. Next slide. So that's the end of my presentation. If you have any questions in regards to my slide, just put that slides or questions about St. Luke's. Feel free to put that in the chat box and we'll answer those at the end of the presentation. Thank you. Anna is from Siouxland District Health. She is going to continue on in the presentations this evening.
All right. Hi, hello, everyone. I don't know if you can see me or not or hear me, so hopefully you can. Maybe Stephanie can let me know here if you can see me or not.
We can see you and hear you.
You can't see me?
We can, yes.
Oh, okay, perfect. So perfect. All right. Well, my name's Anna. I'm one of the nurses here at Siouxland District Health, and you can go ahead and go to the next slide, Stephanie. And well, I've been a nurse here for 8 years. I work at the health department right now. I've done a little bit of medical surgical nursing. I've been an OB nurse. I've done a little bit of NICU, pediatrics, doctor's offices. Now I do public health, and that is my 4-year-old who I have at home as well. Next slide. So some of the stuff that we're going to talk about today is going to be when to call a doctor during pregnancy, and then also for baby, safe sleep environment. We'll touch a little bit about breastfeeding, talk a little bit about false labor versus true labor, just sometimes you don't know what to expect, typically what the hospital will provide, and car seat safety, where you can get car seat safe, your car seats checked, immunizations, and we'll touch on postpartum depression as well. Next slide. And so starting off with symptoms to report during pregnancy. So sometimes we just don't know what exactly you want to report. Typically, these are going to be the things that you want to let your provider know either at your next appointment, or it's going to be something you'll probably have to make a phone call for. So any bloody urine, any decreased in urination, headaches, any disturbances of your vision, any sudden or severe swelling of the feet, ankles, hands, or face. Those are typically something with preeclampsia. And if your doctor hasn't mentioned it, they probably could mention it here later on in a couple of your future appointments. Any vaginal bleeding, any fluid that is also leaking, that could just mean that your water has broken. So definitely get to the either go to the doctor's office or get seen at the hospital if that does happen. Any just unusual pains, chills or fevers, vomiting, contractions early in pregnancy, any skin rash, decreased movement with baby as well. Next slide. So these are going to be more things of when to call the doctor once baby is here. Any trouble with breathing, any blue lips. Usually you'll notice that sometimes if after a feeding, you've noticed that baby has had some, spitting up, make sure you're always raising baby back up or onto the side when you're doing feedings. If you start noticing any choking or anything like that during a feeding, any yellow of the skin or eyes, sometimes it's known as jaundice. So you'll hear that word also in the hospital. If babies are having less than 5 wet diapers in a day, any watery stools or any blood in the stools. So make sure you kind of mention that as well to the doctor. Temperature higher than 100.4 or lower than 97.8 when checked underneath the arm. We don't recommend any more rectal temperatures. I know that was something that in the past, long ago, that was something that they would do, but now they're not recommended. So always checking it underneath the arm. I know they have temporal thermometers as well. Just make sure you notify your physician as to how you check the temperature. If baby is very sleepy or very fussy, also make sure you're letting the provider know. Otherwise, if you're having troubles with 3 feedings in a row, so if baby is just not having any good feedings for 3 feedings in a row, notify the physician and let them know what's going on. The thing I like to tell a lot of women is you are going to know your baby better than anybody. So if you feel like there's something wrong with baby, you can't quite pinpoint what it is, call the doctor. Just say, my baby's not acting right. They're not acting normal. So call them and let them know that there's a problem. And next slide. And so safe sleep. So we talk about SIDS, which unfortunately we do hear of it happening. And we're just going to talk about ways to kind of prevent it, what SIDS is, and, just a reminder of why it's so important to have, for sleep safety. So SIDS is a sudden infant death syndrome. It's the leading cause of deaths in infants in the United States up to 1 year of age. In 2016, the American Academy of Pediatrics Task Force on SIDS updated their national guidelines to reduce the risk of SIDS and other sleep-related deaths. Next slide. And this is just kind of a quick and simple way that I like to talk to parents about it too, is I sleep safest alone on my back in my crib. So the ABCs of sleep. Next slide. All right. So this slide right here, what it shows you is basically the environment for baby, how baby should be sleeping. Baby should always be laying on their backs. If you notice on this picture, there is no bumpers, there's no extra blankets, there's no extra pillows, nothing that can potentially cover up, obstruct baby's airway. Letting your baby also, the other thing too is if you notice baby just has a nice little onesie on, they don't necessarily need the extra blankets on them. The house temperature should be anywhere from 68 to 72 degrees, and they should be fine with just their little sleeper on. I put on here also how important it is for tummy time, because that also helps with building those neck muscles, strengthening, and it helps with development as well. But tummy time is always supposed to be a supervised time. So tummy time is only recommended when you are awake and you are supervising baby. The other thing that I want to point out also on our slide here is that baby is in their crib by themselves. So it's very important to just remember that co-sleeping, as easy as it sounds, it's not the safest thing for a baby, especially moms who are breastfeeding, which breastfeeding is great, but sometimes we tend to get very tired during breastfeeding. So what ends up happening is you can fall asleep, baby's right next to you, and you can potentially roll over, and baby can potentially suffocate. It has happened in the past. There are stories, there are statistics about it. So that's why we say baby sleeps safest in their crib. And next slide. And here is benefits of breastfeeding. I've included our WIC program here as well, because we have a breastfeeding peer counselor program through our WIC program. And I just want to talk about how breastfeeding is a very good thing for babies. You can kind of see on here the differences between what breast milk provides versus what formula provides. I always encourage parents is, if you want to attempt breastfeeding, I think that's great. I think that's amazing. But the other thing is, I don't want women to feel so disappointed and discouraged. If breastfeeding isn't working for you and you've already spoken to the breastfeeding peer counselor, it's something that you're just not able to do. As long as your baby is eating, as long as your baby is healthy, gaining weight, that's going to be the most important thing. We stress on breastfeeding. Sometimes I know I've had the experience here in our health department where some moms are very discouraged because we talk so much about breastfeeding. And although it is great, you will know what's best for you and for your baby, and that's going to be the key thing. Now, if you are not on WIC right now, I know our breastfeeding peer counseling program is only through WIC. So if you're ever interested, just call our office. The number is listed there. Call our office, make an appointment, see if you qualify, and then we can kind of link you up to Laura, who is our breastfeeding peer counseling gal. Next slide. And so this is just a quick little slide about differences between labor. Sometimes, I believe earlier in our presentation, we said that we were in our second trimester, which around this time, sometimes we get Braxton Hicks. So we don't know if it's a real contraction or if it's not real. My pain is different than your pain. So, if you do feel like there's something going on, just make sure you're talking to the provider. But as for contractions for false labor, they're usually irregular. A true contraction will be pretty regular. You'll have it every 5 minutes, every 10 minutes. They're going to be very consistent contractions. And you'll want to call the doctor if they're getting to be pretty regular and close together. The other thing is they don't last long. If it's a false labor, they won't last long. The true labor contractions, they will stay there and they'll keep coming back. The false labor is typically not painful, but like I said, my pain is different than yours. Everybody perceives it differently. If it's something you're not tolerating, if you just have a doubt, call the provider. Your irregular or false labor will stop when you walk around, when you lay down. The true labor pains, those don't go away, whether you're sitting, you're laying down, they're not going to go away. They'll keep coming back. In false labor, your cervix does not thin or open up or dilate, essentially is what it is. True labor, you start to dilate. And next slide. All right. Now, I know Michelle kind of talked a little bit about this and typically kind of what the hospital provides. So they provide the newborn diapers, but the newborn diapers are once you're in the hospital. Of course, once you go home, you have to have your own. Receiving blankets is the blankets that you have at the hospital. Those do stay at the hospital, so those will be left there. So make sure you bring your own. If you plan on doing formula feeding and breastfeeding is going to be something you're not interested in, they do have some formula there. Now they typically do the Similac Pro Advance. The reason why I say it is because if you are on our WIC program in Iowa, Iowa WIC program typically provides Similac Advance. We don't do the pros, and that's just a common question that we've gotten quite a bit. So hospitals do Pro Advance, WIC only will do the Advance. And then we do the powdered, so we don't do any premixed formula here at our WIC office. They do provide the small infant t-shirt that Michelle had mentioned. They also do the pacifier. So pacifier, definitely if you request it, if it's something you would choose if moms choose not to have the pacifier, then that's okay. Just let them know that you don't want a pacifier and that way it's not going to be offered for baby. Also, they typically provide like a baby lotion soap for baby's first bath. And so that will be in the bassinet. And now as for moms, they do have Tuxin spray if that's ordered. Make sure you talk to your nurse about these things. Pain medication, that's the other thing as well. After you've had a baby, you will be uncomfortable. You will be in some sort of pain. So keep an open communication with your nurse. She can provide you with a lot of different options to help you with pain. The mesh underwear, I thought they were pretty, comfortable when I had my little guy. I mean, I guess that's just something that you'll have to find out and see if you like them or not. They also provide the feminine pads. Now, if you prefer to bring your own pads to the hospital, that's completely fine. But if you do need some, there will be some available. And next slide. All right, so car seat safety. Now, this is an image that I pulled right from the CDC. So if you do have any questions, the CDC is going to be your best guide, because this image right here goes up until baby, or from baby all the way until they are ready to be out of a car seat booster and just regular seatbelt. So the most important thing is with you, when you go home with your baby, baby will have to be in a car seat facing rear facing. They will be in the back facing the back. Now the base, when you do go to the hospital, our next slide here in a little bit will show us where you can get your car seats checked. And here in our local community, the fire stations, you typically have to make an appointment. But now when you go to the hospital, you don't have to remove the base from your car if it's already been installed. The only thing that you'll need is going to be the actual car seat. So you can leave the base in the car. But as you can see here is that you will have to have, so babies will be in the rear facing car seat until from birth until 2, or sometimes if some babies just grow a lot quicker, depending on what the recommendations are for your car seat for the weight and length. And next slide. And these are our local inspections for here in our community. So as you can see, I did list some numbers and then the locations, everything is on there. Most of them you do have to make an appointment. Mostly you have to make an appointment, especially with everything appointment only currently with COVID. Usually everything is appointment only. So we can always get these numbers for you and put them in the chat box. if you're ever curious or want to know, get an inspection. Or if you install your own car seat and you just want to make sure it was installed appropriately, you can always do that as well. Just have them check it, and they are more than willing to have it checked. And next slide. All right, so as everything, I mean, there's just a lot that happens with babies and during pregnancy. I want to touch base on immunizations because I only have one little one and he's 4. And if I wouldn't have been told that my baby was going to get poked after birth, then I would have never known. So that's something that I feel like a lot of moms, if it's your first pregnancy, you don't know exactly what's happening right after the delivery. So that's kind of why we're talking about immunizations. So here is the schedule. At birth, babies will get 2 vaccines. Well, one's a vaccine, the other one is vitamin K. The other thing that they get is going to be an ointment that covers their eyes to prevent any infection. So that is your typical routine after you've had baby. If there is, for whatever reason, something that you would like not to be done, or you don't want to vaccinate, just make sure you're talking to your provider or your nurse. You talk to your provider, talk to your nurse who's going to be there, because this is something that does normally get done. You will sign a consent, typically giving the authorization to give baby their first hepatitis B vaccine. So they'll get the first hepatitis B vaccine after delivery. They do, typically they'll have skin to skin, and then they'll let you know when they're going to do the vaccines. So like I said, they'll get their first shot of Hep B at birth, then they go back in typically around 2 months. So your first year with baby is going to be appointment every other month. It almost feels like. Now, at 2 months old, babies have a well child or well baby visit. So these well baby visits are going to be very vital, very important, because what happens at these appointments is they're not only getting vaccines, but they're also checking development. So your pediatrician will actually start talking to you about development at 2 months old. Babies should start doing certain things. They're going to be more alert. They're going to be looking around a little bit more. They're going to start building their neck muscles, because tummy time is going to be vital around this time as well. So they'll kind of start looking at that. They'll have another well baby appointment at 4 months old. And so their 4-month-old appointment, they also have to meet milestones by that time as well. 6 months old, the same thing. 6 months, they get vaccines all over it. They'll get vaccines again. But the other thing that is very important at 6 months is that babies will start getting introduced to baby foods around 6 months old. So we want to make sure that you're going to your well baby appointments, because we want to make sure developmentally that they are also ready to start these baby foods around that time. And then they don't get vaccines up, and so you get a little bit of a break, and it looks like again at 1 year. So at 1 year, you get baby will get vaccines, not as many if you're staying on track, but they get vaccines all over again, and then you get a break again. So that's typically the immunization schedule. And like I said, they kind of pair up the immunizations along with when you go in for your well baby appointments. The other thing is, if you are on WIC, we kind of keep an eye also here. We have checklists, developmental checklists, if you're ever curious, or even in general, if you're not on WIC and you're just curious and you're like, okay, well, is there something that I can check baby's development? And there's actually an app that you can download, and I can later upload it to the link, but because I don't think I included that on our presentation, but the Iowa Department of Public Health actually has an app for milestones. So you can always track, and you can have that app and see what your baby is doing, where baby should be. And if you have a concern, obviously, always talk to the doctor, because like I said, no one will know your baby more than you will. So if you have a concern, talk to them. And next slide. And now talking about postpartum depression. So this slide I included because I feel like we do talk a little bit about it, but just from my experience in public health, it is something that I feel like we just need to stress a lot more, especially with moms. If you have a history of depression, if you have a history of anxiety, Be very open with your provider, because sometimes what happens is your depression, your anxiety can sometimes heighten after, during pregnancy or even after. So it's very important to kind of mention this to the doctor. Usually what I tell women is the first 2 weeks. So the first 2 weeks, it's very normal to have what they call the baby blue symptoms. You're going to be having some mood swings. You're going to have anxiety, especially if this is your first baby. There's going to be some sadness, some irritability. You're going to feel overwhelmed. The tearfulness, the crying, that's all very normal. What I tell my women when they come here to our WIC appointment is, if you really think about it, it's kind of like being on your period times 10. So that's sincerely the best way you can actually look at it. And I just tell women that this is just very important for you to take care of yourself as well. Talk to your support person, talk to your family members, talk to the provider to make sure that you are not going down a road where you don't want to go down. And if these symptoms are not kind of going away after 2 weeks, that's when you want to talk to someone. Also, make sure that if you do have a support person, if you mentioned it already, I know it's really hard, but listening to that support person if they notice a change as well. But otherwise, let's see. And we can go on to the next slide. And so, yeah, that concludes my presentation. So these are just services that our health department has to offer. We have maternal health, we have the WIC program, we have VFC, which VFC is for so if your doctor's office does not provide immunizations, if you are on Iowa Medicaid, for example, and if your doctor's office is not providing vaccines for Medicaid, then you would come and have your vaccines for your baby done here at the health department. If you're if you want to talk to us, sometimes we can correlate a WIC appointment with a VFC appointment. That way you're not making 2 trips. We can try to do that as well, just depending on how things work out. But we do vaccines here. We have our iSmile program, which iSmile is so dental screenings, anywhere from birth up to 18 years. We can do dental screenings for children, dental screenings for pregnant women. We apply fluoride for children and also for our pregnant women. If you would like, we could do that. I know iSmile also has a sealant program, so they provide sealants for children. These are free services, so just call and make an appointment. If you can't find a doctor or you would like a dental screening, we can definitely do that. We have 3 dental hygienists now on site, and we can schedule an appointment for that. We are one of the locations for our HOPES program, which I know they will be presenting soon, but we have them here also within our health department. Lead testing, that's the other one. We provide lead testing through our lab, so you can always call and make an appointment for children, anyone from 1 and above. We can do that. We have the child health specialty clinic as well. They are in our department, kind of across the hall from us in the WIC office. And then we also offer STI exams. So those are free. You can always just call and schedule an appointment, and DNA testing as well, done through the lab. And I leave you now with Bridget from HOPES with the Crittenden Center. Thank you.
Bridget?
Sorry about that. Can you hear me?
Yes, we can hear you now. That's fine.
Okay, great. So my name is Bridget Straight, and I am the Director of Education at the Crittenden Center. So we have 2 programs that I'm going to talk about here today. We have 2 parenting programs. One of them is a short-term parenting program, and the other is a long-term parenting program. The resource center is what we call the short-term parenting classes. And when you take classes with us, you will be offered, we'll do a screening on you and we'll meet you, we'll talk to you, and we'll kind of decide how you want to go about your sessions with us. Right now, our sessions are virtually. Most of them are because of COVID. You can come into our office and do some parenting classes as well. Next slide, please. Okay, so our parenting classes are free with the Resource Center. And basically, we're going to help you with whatever parenting advice that you are needing at that time. If any of you have toddlers, babies, you know that there is a lot of things that there's no book for anything and everything can just happen. So we are going to be that support that's going to be there for you. And we can help you with any teenager behavior as well. So any stressful situations, activities with your child. We really want to focus on building that relationship with your child, that parent-child interaction. We also go through and help you learn about the stages of development with your child. There's so many, and there's milestones a lot of people don't know about. So we're going to help you along the way with those. We're going to help you to model good behavior to your children. We're going to coach you along with that. The sessions are going to be anywhere from 6 weeks or 12 weeks. So when you sit down with your family support worker, you will kind of decide the path that you will take. And that will kind of be determined based on your individual plan. And you will receive a certificate upon completion. You do have to complete the course in order to receive an incentive. And some of the incentives that we have, most people choose a car seat just because there's not a lot of programs in town that will give you a car seat. And like it has been said earlier in the program, that you cannot leave the hospital without a car seat. So most people choose a car seat. You don't have to choose that, but we'll kind of find the right incentive for you. But like I said, it's really important that people understand in order to receive that incentive, they do have to complete the course. High chair, stroller, diapers, anything. If you choose not to receive a big incentive, we'll kind of help you and give you some options with what incentive you're going to choose. Next slide, please. So when you originally sit down with the family support worker, you will kind of go through some goals. What are the goals that you want to learn from the program? Maybe for somebody, it's a prenatal mom and they want to learn about breastfeeding. Maybe it's somebody that has an older child. So it is going to be really geared towards your specific needs and the needs of, the age of your child, things like that. We do prenatal, we do lactation services. We do have a certified lactation counselor on staff. So we will talk about, like it's been mentioned earlier, the importance of breastfeeding. We support what mom chooses. We will support her along the way with that. What to expect during delivery, infant care, self-care, all of those things we really want to focus on and preparing mom for birth of her baby or just along through the journey wherever she's at. Next slide, please. Like I said, when you meet with your family support worker, you will you'll go over your goals and then you'll discuss which curriculum you'll want to use. You don't use all these. These are just kind of our most basic ones. We do Love and Logic. That's kind of, I would say, probably the most popular one. But it just depends on where you're at and what you'll want. And you may not know what you'll want, and you'll go through that with the family support worker and decide what's the best curriculum for you. Next slide, please. Like I mentioned earlier, our classes right now, just because of COVID, are a little different. We are not doing in-home right now, but you do have the option to come into our office in a controlled setting here at the office. We do require that both parties wear masks in the office. We offer Spanish classes, English classes, group classes throughout different sites throughout our community. We do group classes. Our services are for free for anybody that's in Woodbury or Ida County. If you are outside of Woodbury or Ida County, we would work with you and talk with you. There is a fee for that if you're outside of those counties. And we do provide services up to 17 years of age, which a lot of the programs in town are 0 to 5 age. So it's kind of hard to find programs at that 5 on up, teenagers. That can be a very difficult stage for a lot of parents. So we can help you with those older ages as well. I think that's all with this one. Next slide, please. We do have, so when you call, I left the contact information here for Blanca. She's a supervisor in this program, and you will meet with her, and then will assign you a worker, one of our 2 workers. And again, if you're Spanish, we offer those sessions, and then we get you going in the program. That is the Resource Center. Next slide, please. The HOPES program is another program that we offer as well. The HOPES program, there's actually 3 agencies in town that offer this program. LSI, which is Lutheran Services of Iowa, Siouxland District Health, and Crittenden Center. We all have the HOPES program, and we collaborate as one HOPES program in town. So we actually bounce referrals, around with each other, and we're kind of one, and we work very well together. But we are different agencies, so sometimes that gets a little confusing for people just because we're different sites, same program. Healthy opportunities for parents to experience success is what HOPES means. So our HOPES program is a long-term program. So families are going to be in this program. They can be in the program to up to 5 years of age. Typically, when children are school ready, then they go off to preschool, and then they complete the program. It is a intensive program, I would say, because usually between the first 6 months to a year, depending on how the family progresses, they will be weekly 1-hour visits. And this program as well, the different sites kind of are a little bit different with this. I believe most of us are doing virtual. There might be a couple workers that are going into the homes. That is program or agency kind of decisions on that one. But we are doing virtual visits for the most part for this program as well. And then after a year, families will progress through a level system. They may meet biweekly, then monthly, then quarterly. It just really depends on when the family meets their goals and kind of where they're at in their stage of parenting. Next slide, please. So how can we help you and your family? We're going to connect you to the community resources. One of our main goals of the program is to have the family become self-sufficient. We want to connect you to those resources. We're going to help you with, say you needed help getting set up with WIC, things like that. We're going to help you. We can help you with, connect you to resources with housing, different things in the community we're going to help you with. And we want to show you the skills and the tools so you can become self-sufficient throughout your journey as a parent. We do depression screenings on mom. As has been mentioned earlier, that is a huge thing, especially after birth. We do regular depression screenings. We do developmental screenings, which are called ASQs. Some of the pediatricians in town do the ASQs. That's going to help us to, if we see any red flags with your child's development, any areas that maybe they're a little bit behind on, we're going to give you the skills, give you some activities to try to improve that. And if we're still noticing that, we may need to do a referral to the doctor, to AEA. So it's that early intervention service that's so crucial to your child's development. So we really focus on that. We're going to help with parent-child interaction. That is one of the main goals of our program, is we want moms and dads to have better parent-child interaction. Many of us on this call are parents, and who doesn't want to interact more with your kids? We're so busy with the hustle and bustle of life and getting off work and making dinner and running here or there. Like, sometimes we need to just remind ourselves to slow down and get down on the floor with the kids and play with them. And so that's so important. That helps so many skills with that child. Their language skills. The more you talk to your child is going to talk more. They're hearing everything we do. So we're just kind of helping parents see that and coaching them along to have better child interaction. Next slide, please. So how can we help you and your family? Being a parent it's really, really hard. And I think that especially first-time parents, and even if you're not a first-time parent, it's just hard. So we want to help you gain that confidence as a parent and just reassure you, let you know, encourage you that you're doing a good job, because there's going to be times where you don't know what you're doing, and we're going to be there along the way to help you, guide you, and like I said, encourage you, because it is hard. I talked about the developmental screenings, depression screenings. One of another big thing that we do, and it's a little different right now because of COVID, but community events, that's really important. We really try to encourage our families to get out in the community, and some families don't have any other friends, don't know what's out there. So we really try to connect to our community. We have a really big social community here in town, and sometimes you don't hear about things that happen. We're going to push all of that stuff to you as much as we can. School readiness, hands-on activities, listening skills, all those things, we're going to help prepare your child for school. Because when you complete, as you progress through our system, we're with you for several years here, and you're really going to build that relationship with your worker, and we want to give you the skills and your child the skills, so when they go on to preschool and to kindergarten, they're ready. They are ready to go, and you've helped them along the way. So we're going to help with those hands-on activities. Some of my staff, I have one staff in particular that loves artsy stuff. And so for every holiday, anything, she and even through virtual, she can still have the family, get out a scissors and a piece of paper, and she'll do a little art activity. And that's so fun for kiddos to do that. And, sometimes as parents, we don't think to let them have a scissors and cut, obviously if they're older, just let them get a little messy sometimes. Reading is so important. We're going to help and encourage you through all of that. We really want your kiddo to be ready for school. Next slide, please. So who is eligible for the HOPES program? So we really want to get moms enrolled prenatally in our program, because it's so important prenatally to know, the care that you need for your body, and all the things that go into labor and delivery and all those things. So we really want to get moms prenatally, but we do have a kind of short cutoff frame. Once mom delivers the baby, once that child is 3 months of age, they're no longer eligible for our program. So we would refer services somewhere, another partner agency that we have, if that child is above 3 months of age. So we really want to focus on that early intervention, getting in there early and just starting services, education, all those good things that we provide. We do provide services in Woodbury and Ida County. And our program is free and 100% voluntary. So that means that parents We really want parents to 100% commit to this program. It is a journey. It's long term, for 3 to 5 years. That's a long time. And we just really want you to make that commitment. You're building that rapport with your worker. And, some people end up looking to that worker as part of their family. They'll send them pictures and it's their first birthday, things like that. And it's really special to see those relationships be built. Next slide, please. So like I mentioned earlier, there's 3 programs that have the HOPES program in town, and we work very closely together. We have a family referral specialist that is housed out of the health department. And so most of our referrals will go through her. Her name is Elizabeth, but you can always contact LSI, Crittenden Center, and we work through those referrals with her as well. And like I said earlier, the visits are virtual for the most part and in English and Spanish. Next slide, please. Our program is very strength-based. We're not going to sit there and tell you the things that you're doing wrong. We're going to support you, we're going to guide you, and we're going to coach you through the program. We follow a national model that it's nationally accredited. It's called Healthy Families America. And it's a just fantastic program throughout the nation. The goals of the program, I kind of mentioned earlier that just the positivity, the parent-child interaction, the child development, we're really going to focus, it was talked about earlier, the immunizations, we really focus on those things. We want your child to have everything that they need. We work with the doctors as well, everything that they need to be as healthy and developmentally on track as they can. Coping skills. Sometimes, it's hard for parents to help their children with coping skills or even themselves. So we're going to help with that. And the overall one of our program goals is to reduce child abuse and neglect. It is sometimes hard. Discipline is a huge thing. So we're going to coach you along the right path with that. We are early intervention, and we do want to decrease that child abuse and neglect. Next slide, please. And as I mentioned, Elizabeth is our referral specialist at the health department. You can contact her, or you can always contact me. If you know somebody at LSI, you can contact them as well. We all work together with our program. And I believe that's it for me. And I think Stephanie goes back to you maybe.
Yes, it does. Thank you so much, Bridget. What a wonderful presentation from all of those who have helped on tonight. So I've been monitoring the chat and the Q&A. I haven't seen anything posted, but this is that opportunity where if you have any questions, now is definitely the time where we would love to answer those questions for you. So I'll just give it a second because you can't unmute yourself. You would have to type your questions in. So I'll give you a little bit to see if there's any questions. Otherwise, we're going to go ahead and announce the Pack and Play winner. For everyone who is on the line tonight, you will receive a $100 gift card to Amazon. And so I will be sending that to you via email. So it'll be an electronic gift card. All right. I don't see any questions yet. I'm going to check one more time. Okay. All right. And the winner of the name that was drawn for the Pack and Play is Jimmy Ramirez. You are our lucky recipient of this wonderful Pack and Play. So I will be sending you an email to the email address that you registered with, so that I am able to send this directly to your home. I'll need your address. So please look for an email from me within the next day. Also, Each of you will receive a copy of the PowerPoint and the recording of today's webinar so that you can sit with family members or your partner or significant others and watch this again if there was anything that you missed, or you can just read it from the PDF that we will send you. I want to thank everyone again for joining us on tonight. I want to give a special thanks, a shout out to Amerigroup, who is the sponsor of these baby showers, Siouxland District Health Department, and Unity Point, as well as Crittenton Center. So thank you so much, everyone, for joining us on today. Have an amazing rest of your week. Thank you so much. Bye-bye.